Hello and welcome to Hump Day Hormones. This is season 2, episode 48, and it is November the 12th, 2025. And we are doing a continuation of our head to toe menopause series today. We are talking about the hairy truth about hair loss and menopause. So we're going to kind of do some menopause, estrogen, iron. We're going to throw in like the power of beef liver. So that was mentioned last week by our guest that was on for our brain fog episode. And I just wanted to take a little bit deeper dive into what is the deal with beef liver and beef liver supplements.
It's kind of all the rage right now,
Yeah, I've heard a lot of talk about it, and basically, we'll talk a little bit more about it in a second, but it's a good way to get some iron, and it's a very nutrient-rich kind of supplement, and if you don't tolerate the regular iron that's more plant-based and harder to absorb, then it can be a good way to get that without having to, actually eat beef liver, because who would do that?
Well, right. And here you go. One of our Did You Know? Did you know that beef liver is called nature's multivitamin and is one of the most nutrient-dense foods on the planet?
You know what, Courtney? I did not know that.
Now we do.
And now we do.
And luckily there's ways to get it other than just like eating a hunk of beef liver. You can get it in capsules now, dehydrated, ground down, and put in capsules, and you can take it that way.
Yeah.
Much better source.
That's going to come in handy. So if y'all listened to last week about brain fog and you heard Chelsea Preston, our guest, say that, and you were like, what the heck? We also kind of thought that. And we took a deep dive, and it's pretty well founded and some good stuff. So go back and listen to last week's episode, and you can figure out why it was important for your brain. But keep listening to this week's episode, and you can figure out why it's important for your hair.
Love it.
Yes. And so Courtney and I are a little bit, I just have to get this out there. But we're a little bit on the struggle bus this morning. It's mostly me. Courtney's calm and collected, but I don't know what's wrong with me. We recorded this whole thing. It didn't record on video. We're trying to have this YouTube channel. And then I was trying to edit even just the audio, and somehow we lost it. So this is like round 2 recording this.
Yeah, we've already done it once this morning.
We've already done it. So we are well versed in this topic, and we are happy to share it with you. But, it's just a little learning experiences as we go. That's never happened. We're 48 episodes in, and I've never lost one. But there we are. We can say we've done it all now.
Yeah, really no surprise. It was bound to happen. We are not the AB technical girls. We are the hormone girls.
Yeah.
You are the hormone surgery baby. All the things, girl.
Yeah, but AV equipment is not a thing.
This is not our jam.
I wish we could have maybe released some of the blooper videos because they were really funny. When we were trying to make sure we had it this time.
Oh, maybe we'll do that on our social media.
I know. And then we were saying, too bad this wasn't the brain fog episode because we sure seem like we're driving that bus this morning. But yeah, we're going to talk about how you can have beautiful hair. And I know that a lot of people think that's like for vanity purposes, but I really encourage you to think about that as a window to your overall health, because if your body is healthy, then we're going to kind of be able to prioritize those things that seem, maybe a little less important, so to speak. But most women I know think that is a pretty important thing. And we see this all the time. And so another one of our Did You Knows is that 50% of women experience hair loss in menopause.
Oh, yeah. So common.
Yeah, I would have thought it was higher, honestly. I would have thought it was like 80%, but yeah.
And did you know that there are hormone receptors found in the hair follicles, the sebaceous glands, the dermis, and the epidermis layers of the skin?
obviously it's the biggest organ in our body. So I think it makes sense that, hormones are not going to leave that one alone and touch every other organ system. So
right.
It makes sense. And then I love this little fun fact. The active growth of a hair follicle requires a lot of energy. So we always talk about that cellular energy and metabolism decline as we get older, and that cellular transport times slow and things like that. But so that is all going to be involved in making your hair too, and that's going to slow down. And so that may explain some of the age-related like hair changes that we have. But to produce a single gram of hair requires 670 kilojoules of energy. Well, who the heck knows how many kilojoules we're burning? But
right,
when you look this up, to burn 670 kilojoules of energy, you would need to expend about 6 minutes of intense exercise involving your arms and legs. So think about jumping jacks for 6 minutes. That's how much energy it takes to build a gram of hair. That's crazy. Like if I got up and did 6 minutes worth of jumping jacks right now, I'd probably have like a breathing attack or something.
I would be full on out of breath, sweating, everything. And so we just kind of have to remember, like, as we get older, metabolism changes. Maybe there's other things in our body going on. Our body is not going to focus its energy towards making hair and producing more hair and helping hair grow. So we need to be
an accessory.
Yeah, sadly. So it needs to help keep you alive. Your body is trying to keep you alive and not spend its energy on hair. So it's like, what are all the things can we be doing, to help support like a good foundation, and help improve hair loss?
Yeah, so obviously our favorite, we're going to start with hormones and hair loss. So we'll get into some supplement stuff later. But hormones, we'll start with our two big girls here.
That's right.
Estrogen and progesterone. They're always the hard hitters. But
that's right.
Estrogen and progesterone keep your hair in the growing phase. So, you kind of have to understand hair cycles, and most hair cycles, or all hair cycles, are going to have the anagen, the catagen, and the telogen phase. Most of our hair is in the anagen phase, that growth phase. And then the telogen phase is when hair is falling out. So we don't want a lot of our hair in that phase. But when our estrogen drops, we are going to push more hair over into that phase. And so estrogen keeps hair like having good vascularization and nutrient delivery to the scalp.
Right. And then there's big times whenever our estrogen and progesterone levels drop, and that is going to contribute to hair loss. So postpartum is a big one for sure after you have a baby. I would say most people experience some type of hair loss or just increased shedding. Perimenopause, and then after stopping a birth control pill. So we've, suppressed our own ovarian function, and then sometimes there's just a little bit of like a period in between where those ovaries have got to wake back up and start working on their own. So those like rapid hormone fluctuations and changes are going to have some effect on our hair.
Yeah, and so you'll take away the estrogen, you'll push the hair in more to that telogen phase, and so that hair loss, that diffuse overall shedding. Oh my gosh, I'm having to clean out my brush all the time. I'm pulling out clumps of hair when I wash it. That is called telogen effluvium. And so that usually starts about 2 months after the hormone event. So 2 months postpartum. So it's not like you deliver your baby and then the next day all your hair falls out. But, about 2 months later, you're going to start to have that effect as you move into that telogen phase. And then usually it would stop on its own within 6 months. So it is sort of a time limited event if you did nothing at all. But if you help support yourself through that, then it'd be better. And I think when you think about it from like a postpartum standpoint, that's like a one and done. So it's like, could I deal with 6 months and then just know that my hair growth is going to come back? Which is, I feel like, the place where most OBs live with that. It's like, oh, it's temporary, it's fine, it'll come back.
Mm-hmm.
But we can't really say that in perimenopause because that's like a 7 to 10 year event. And so
True.
If you're like, okay, well, it'll stop 6 months after your hormones normalize. Well, there is no normalize. Like, we're not coming back from that. We're actually going to get to the place where normal is no estrogen. But again, that's bad for your hair too. So you sort of are forced to intervene in the perimenopause, menopause space if you want to come from a hormone standpoint, because there's not, I hate to say it,
You're not gonna like
there's no
rebound.
end in sight.
Yeah. You're not gonna like rebound and all of a sudden start having good normal hormone production.
Right. Unless you're replacing it. So I think that's where
we come in.
That's where we come in. Yeah. And then on our first recording, on take one this morning, we were talking about, I love this idea that, because it makes so much sense that like estrogen is building the framework. It's building that vascular supply and the neurological supply and all that. And that's the same thing we talk about when we're talking about genitourinary syndrome and menopause and kind of that vaginal atrophy. Like, we're bringing the blood supply back. We're going to force the regeneration of the collagen. And then we can work on, things like sex drive and things like that. But it's that underlying architecture. So it's not going to matter what kind of shampoo you use, or like with GSM, what kind of lubrication you use, if you don't fix the underlying architecture.
Yeah.
So,
yeah. I love that. Yeah. Little analogy. Makes sense.
And then, usually about 10% of our hair lives in this telogen phase, like most is in that anagen phase. And in the normal, we're losing about 100 hairs a day. But in telogen effluvium, where we push more over into that shedding phase, we can lose about, like 30 to 50% more hair. So that's quite a bit. I mean,
yeah, for sure.
100 hairs a day is kind of a lot anyway. So 100 is about 10%, and then we shift up to about 30 to 50%.
Right. That's a lot.
And
then there's other things that can cause hair loss or contribute to hair loss. And so you can kind of see this after an illness, like after having COVID or having a big weight loss. Like if you've been doing a bunch of Ozempic and lost 50 pounds in 3 months. I mean, that is a big shift in our bodies. And so that is then going to cause a big shift in your hair as well. And then there's a bunch of medications that contribute to hair loss, which is really interesting because I feel like some of these you wouldn't really think of being contributed to your hair.
Right.
So I think that's kind of interesting to look at. I mean, things like blood thinners, like warfarin and heparin, that can be associated with hair loss. Blood pressure medications, like beta blockers and ACE inhibitors, can do that as well.
Yeah, so just for people listening who don't know what a beta blocker is, those are the drugs that end in LOL, so atenolol, labetalol, anything that, think of the emoji, LOL.
Right.
And then the ACE inhibitors all end in pril, so that's like lisinopril and enalapril, those type of medicines. And then some antidepressants and mood stabilizers like lithium. That would more be used in like the bipolar setting, and then some SSRIs like Zoloft, also called sertraline, or Prozac, which is fluoxetine, and then Celexa, which is citalopram. And then Paxil, which is paroxetine, is the one that's least associated. I mean, I think all SSRIs have an association, but that Paxil, which is also used off-label for hot flashes, is least associated with hair loss. And then some cholesterol-lowering drugs, that's like the statin family, so they're usually going to end in statin. Lipitor is the most, I guess, famous one, the atorvastatin. But, which I think this list is interesting too, because if we think about who gets high cholesterol and high blood pressure and some antidepressants thrown at them in midlife, is like, that's like the perimenopausal, pill box right there.
Yep.
Is we've gotten some high cholesterol and high blood pressure, and now I'm anxious, so I got an SSRI. It's like all of those things that we're more prone to be on in midlife are also, not good for your hair. And
right.
so, not that we're going to see somebody and take them off of their cholesterol medicine, but, and we'll talk about this when we get more down into the heart during our head to toe series, but like, there's a lot of ways that estrogen can help improve your cholesterol just by itself. And so if we're optimizing some hormones, we may get to a place where we're able to come off of that, but or for sure able to come off of some antidepressants. And if we lose some weight, we may be able to come off of some blood pressure medicine. So I think in some roundabout ways, hormones can help you do that.
Yep.
Yeah. And then birth control pills lower estrogen because they just like decrease your overall ovarian production of estrogen. And so for some people that what's in the birth control pill is not enough, and so they're going to have some hair loss from that. And then tamoxifen decreases your estrogen. That's the whole point of using it in breast cancer patients. We're downregulating those estrogen receptors. And so anything that's messing with your hormones might have that kind of side effect of hair loss as well. So, I think that's also interesting.
Yeah, it really is. Yeah. And it just is, where, especially if somebody is coming in and, really having some hair symptoms, it's worth kind of looking at the person as a whole. What do they have going on in their life? Are they perimenopausal, menopausal? What medications are they on? I mean, kind of all the things.
Yeah, for sure. Okay, so next hormone, testosterone. So I think that the take home point here is that we don't want to think that testosterone itself is bad or that everyone on testosterone is going to have hair loss.
Right.
But testosterone is converted to dihydrotestosterone, and we all have variable ability to do this. So there's an enzyme called 5-alpha reductase that does this conversion. And everybody has that enzyme, but everybody has just a little bit of a different, it's called a genetic polymorphism. And so, mine might work a little bit differently than Courtney's or whatever. And so I might be a better converter, which, is not necessarily an awesome thing for a female.
Right.
Because dihydrotestosterone is what causes oily skin and acne and some hair growth on your face and some hair loss on your head. And so you might have the exact same testosterone level as somebody else, but your conversion to dihydrotestosterone is just maybe a little bit different. And so I think that we have to keep that in mind. And then we know that we can block that enzyme. And so that enzyme is really active in your skin, your hair, your prostate, which, we're not worried about that ever. And then your liver. And so we can block it in those places and you still get the all over effect of testosterone. So some people are like, well, I don't want to block that. It's helping my sex drive. No, you're still going to get help in those places and like with your muscles and your bones and your sex drive and your mood and your libido and brain fog and all those things that we love testosterone for, but we can block the conversion of the skin and the hair for this maybe either hair growth with too much testosterone or hair loss on your head. So I think that, you have to think about probably when you were a teenager is the best window to look at. Like, were you somebody who was really plagued with acne and oily skin, had to wash your hair every single day or it got super oily? You probably had a pretty good conversion to dihydrotestosterone at that point. So I think if you were somebody who's really struggled as a teenager, then just know that if you do use testosterone, you may be somebody who benefits from maybe adding spironolactone to block that conversion.
Right.
Yeah. So, and then also it's why like the 60-year-old menopausal women come in here sometimes with some hair growth on their face and they haven't taken any testosterone.
Yeah.
Their testosterone level is not even really that high, but it's just relative to the estrogen. It's the only thing that the hair follicle receptor can see. And so we don't have any estrogen to grab onto. So it's just like, I'm a hormone receptor. I need a hormone. And the only thing available is testosterone. I guess I'll use that.
Yeah.
And so it's why, a lot of times women who've been in menopause for, 5-10 years, now they're getting the hair on their face. What's going on? It's like, well, testosterone was all that was available.
Yeah. Yeah. Because you're getting some of that production from the adrenals.
Yeah.
And so just kind of that imbalance of having testosterone and not having estrogen is really what is kind of contributing to those hairs on your chin.
Your chinny chin chin.
No.
Yes. And then the androgenic alopecia is a lot of hair thinning like in the crown or the temples. Yeah. And so also going to come with some of that oily skin and acne. So it's really more of a genetic predisposition for how your little 5-alpha reductase enzyme works. And so it's not an every single person on testosterone will lose their hair, but I think we have to know our history. Like, were we sensitive to testosterone as a teenager when we were probably making the most we were ever going to make?
Right.
And then we really have to avoid some super physiologic levels. So we stress this all the time, but with testosterone, it's really important that we're monitoring your levels. And we're keeping you into a range. Everybody absorbs it differently. Testosterone is mostly topical or injected in the fat space and absorbed from there. And so everybody's going to do that differently. So we have to follow your levels, and we also have to really watch the super physiologic levels. So pellets are pretty notorious for doing this. They shoot people up really high. It feels really good. And you have a really good sex life and energy and all the things. But long term, those super physiologic levels can kind of cumulatively add up and lead to these kind of effects.
Yeah. I mean, I've seen it a few times where, somebody's been getting pellets for years and they feel great. They're like, I feel great. I just want to keep getting pellets. But they're having like some thinning hair and hair growth on their face and even seen like some, liver kind of gallbladder issues too that has come from just long-term high dose testosterone. So those are signs like, okay, we got to back down. I know you feel great. I know you do, but you're gonna do have to back down from there.
Yeah, and I think most people can probably feel great. I mean, it's like, does it need to be 250? Could you feel just that great at 100?
Yeah.
I think it's one of those, it's kind of like B12. It feels really good when it's 800 to 1,000. You're not going to feel any better when it's 2,000. I mean, it's like, there's only so much B12.
Yeah.
You're just going to, kind of pee out the extra, except that you don't pee out the extra testosterone. It hangs around in there and needs to bond on to something. So, I think, if we must talk about cortisol, I feel like we never say anything good about it.
One day we're going to give some love to cortisol, probably when we get down to the adrenals. It's all about balance though with cortisol and these adrenals and all the other hormones. Is too much cortisol is not good, too little is not good, and both of those contribute to hair loss. Yeah. So, talk about just too much stress, and then that eventually leads to this like adrenal insufficiency, adrenal fatigue kind of situation, all bad for your hair.
Yeah, and I think, cortisol, when it's high, pushes hair into that telogen phase. And so, like when we were talking about post-COVID hair loss, that's probably from running around on cortisol trying to cure your viral illness,
Right.
And then the weight loss on Ozempic hair loss. Again, like when you're not eating consistently because your appetite's so suppressed and all those kinds of things, then yeah, we talk about that a lot, that maybe like the fasting or the, like people forgetting to eat until 6 o'clock at night isn't big. Like that's probably, yes, you will lose weight, but not good for your cortisol. And so when we're losing rapid weight like that, our body is like, oh, fight or flight. We're in a famine. We need, we need nourishment. And so we must be stressed. So I'm going to pump out a bunch of cortisol, push your hair into the telogen phase, and all of a sudden you have hair loss. Yeah. And then, too low of cortisol is a whole nother problem. That's a lot more rare. I feel like too high of cortisol is most people's problem, but too low of cortisol, that's like Addison's disease or truly the end result of adrenal fatigue. But that's like, we don't even have basic life sustaining measures. Like cortisol, we need it to wake up in the morning. We need it for our blood pressure. We need it for vascular tone. Like all of these things that like you can't not have it. It's essential. You have to at some point have cortisol. And so if you're not making that, then all of your adrenal energy is going to that. And therefore none is going to any of the other hormones. And then, the end result of no hormones is hair loss. So, right. Yeah, I think it all makes sense, but
Up next is the thyroid. I think that all makes sense too.
Yeah.
I mean, most people, whenever you think about hair thinning, hair loss, thyroid is probably the first thing that comes to mind. And so you can see hair changes in like both hypothyroidism and hyperthyroidism. Both of those can lead to like dry, brittle hair or hair loss kind of all over the scalp.
Yeah. I think, most people, I mean, it feels like this is like a no duh, kind of segment, because I feel like most people know that thyroid, but I feel like, most people don't think about that too high of thyroid too. So it's again, just really important to kind of check your levels. There's, the other symptoms with thyroid disease would be different. I mean, they both can have hair loss, but like, or changes in hair texture or that kind of thing. But the other symptoms, like hyperthyroid people usually have like a fast heart rate and they're losing weight, and hypothyroid is like sluggish, tired, gaining weight. So the other symptoms are different, but if you just went off of the hair loss, it may be hard to tell. So T3 is a big deal. I mean, if we don't know that yet, then oh goodness. But we have a whole thyroid episode. If you want to go back and find that, or we'll get there. Probably pretty quickly after our ear, nose, and throat. Thyroid's in your neck.
It's coming. 2 more weeks.
We'll get there. But T3 is a big deal. And so T3 promotes that prolongation of that anagen phase and pigmentation in your hair. So.
And then hypothyroidism kind of leads to, like we said, that coarse, brittle, slow growing hair, diffuse alopecia, skin and nail changes, like dry, brittle nails, that kind of thing.
That's right. Okay, so now we're going to get into like nutrients. So here's where we're going to talk about some vitamin D and some iron, and then we can talk about beef liver because
do it.
But vitamin D and iron are both really important in the hair, along with other things like zinc, selenium, iodine, copper, all things that sort of nourish the thyroid in general. But vitamin D receptors are found in the keratinocytes in the outer root of our hair. And so we have vitamin D receptors there. It's so cool.
That is very cool.
Yes. I mean, we think of it like for bones, which I know like, bones, skin, nails, they all seem like the same lineage to me. So maybe it's not that weird, but I think it's cute to think about these little bald-headed mouse, but they genetically engineered these mice without the vitamin D receptors. And so they all developed alopecia.
So sad.
These little
bald mice.
That was in the Journal of Investigational Dermatology.
That's crazy though. I mean, that just shows like they needed vitamin D to grow hair.
So they're probably breaking bones and being bald.
Yes, they were.
Yeah.
Them.
And then there was an article in the British Journal of Dermatology that showed that telogen effluvium patients, so just patients who were having this, I don't know if they counted the hairs to see if it was more than 100 or how they did this, but they all had lower levels of vitamin D. So
yeah.
And then the Brazilian Dermatology Journal, like I'm just going to listen to whatever they say to make me look like a beautiful Brazilian.
I mean, beautiful hair, beautiful skin.
Yeah, I'll listen to whatever they say. They say that androgenic alopecia patients have lower vitamin D, and they were looking at polymorphisms, again, in the vitamin D receptors. So we were talking about polymorphisms in that 5-alpha reductase enzyme. We have polymorphisms really in every type of gene. It's just how you express it. So, and I think that, vitamin D also, like, why wouldn't you want to fix that, right? It helps your bones, decreases breast cancer, helps with mood disorders. I mean, all of those things. And so there's really not a downside to replacing your vitamin D. The cool thing now, or, probably what we should be doing is putting vitamin K2 with our D3. It's D3 we're talking about here. So that we can drive that vitamin D into the bone and it's not hanging out vascularly and causing more plaques and things like that. So, but you have to check it to know how much you need. And so we check that and then we're able to kind of tailor your supplement because they range. I mean, you can find a supplement that's 800 units a day, or you can find a supplement that's 10,000 units a day.
Right.
And what do you need? And vitamin D is important not to overdo it.
Yeah.
Because then you can build up too high. It's a fat soluble vitamin. It stores in your fat. It can get too high and then you can get things like kidney stones and things like that. So there is such a thing as too much. It's kind of like vitamin A. Those are both fat and K. I mean, they're all fat soluble, so you have to be careful with those. Whereas like B vitamins and vitamin C, like whatever, there's not too much. You'll just excrete the extra in your urine. Like you go for it.
Right. Yeah. But vitamin D you have to watch.
That's right.
Yeah. Okay, the next one, iron. Iron is a cofactor in DNA synthesis and cellular energy metabolism. Both things that you need for proliferation of hair matrix cells.
Yeah. Iron also supports our hemoglobin, or it doesn't support it. Hemoglobin is made with the center binding molecule of iron. So you can't make hemoglobin without iron. But hemoglobin is what's delivering oxygen. Obviously, oxygen delivery is the deal to hair follicles. So a deficiency in iron leads to the shrinkage of follicles and premature shift into the telogen phase. There's many articles in the dermatology world that show that. But again, just like vitamin D, you have to check to know. You have to check your iron level specifically, really. You can't just go off of a hemoglobin.
Right.
So you might have enough iron to make a hemoglobin, but not enough iron to do the other things. And your hair is going to take a back seat to your hemoglobin. So ferritin is a really good marker for this because it's our iron storage. So we're using our iron for our essential day-to-day hemoglobin production and all of, the things where iron is important. And then we also have enough that we have a good ferritin level with iron in storage. So a British dermatology journal showed that a ferritin of less than 40 had been consistently associated with chronic diffuse hair shedding. So when we're checking ferritin, we like to keep it up around 60. It's kind of that optimal place. And it's laughable. The lab says your ferritin is normal if it's I can't even remember the range, but I think it's 5 to 150. It's this massive range. Where people are like, oh yeah, my ferritin was 10 and they told me it was fine because, it doesn't red flag on the labs. And it's well, it's fine because it's in the population-based average range, but yeah, it's not optimal. So optimal, especially for your hair, is above 40, but 60 is kind of the optimal just in general.
I think hair is one too that you really have got to dig into, like optimization of the hormones.
Yes.
You know, everything may kind of look normal, quote unquote normal, but yeah, optimizing things like your ferritin. I mean, you're not gonna grow more hair if you have a normal ferritin of 20, you know.
Right.
So.
I know. And then we do have some evidence that, so there's non-heme iron, and that would mostly be like our plant sources, like what we're buying over the counter on the vitamin aisle is non-heme iron.
Like ferrous sulfate,
yeah,
those kinds of things.
Yeah, there's gluconate, all those. So heme iron is different. It's like an animal source of iron, and it is absorbed a lot better. So it's sort of, again, like I feel like if you talk to any dietitian, it's like, well, yeah, we told you that food sources are the best way to always get your vitamins. But some people may not eat a lot of red meat or eggs or, just kind of these heme sources, where we're going to get those things. But the body absorbs heme iron better. We absorb about 15 to 35% of that iron. And then non-heme iron only has about a 2 to 10% absorption. So we know that constipation is a really big deal with iron, and that's because it has terrible absorption in the gut, and so it sits in there and kind of makes you constipated. And then non-heme iron also depends on your stomach acid and vitamin C, as well as your gut health, to convert it to usable form that can be absorbed. And so there's lots of kind of transitions it has to go through. So like if you have a lot of acid reflux and you take a lot of acid reducing medicines like Prilosec or Pepcid or something like that, then you may not have a lot of stomach acid and you may not even be able to activate that non-heme iron. So in a lot of ways, we know that heme iron is better. And so that's where this whole beef liver situation comes in handy. Because if you really wanted to go out and get a good food source, beef liver would be an awesome thing to get, and you could just fry it up and eat it. But it's hard. It's hard for me to even say it without sort of gagging a little bit. I can't really even think about that. I would never, ever do that.
Yeah, I remember my dad growing up, they, would get a whole cow. I think I'm remembering this right. And I mean, they wouldn't just eat the good meat part of it. They would have to eat the liver and the whatever else. I don't know. But I remember him talking about liver, having to eat liver, liver and onions, and he hated it. I mean, I've never tried it, so I don't even know, but I don't think I would ever try it.
I don't know. I would need somebody to disguise it. And that's when I was reading about this, it was you can disguise it and put it in chili. And I'm like, I don't know.
We're just going to take it as a supplement.
Yeah, you can also dehydrate it and grind it up and put it in a capsule. So, but beef liver and beef liver supplements are well supported by the nutritional studies. It has a very high nutrient density index. I didn't even know what this was. I didn't even know this was a thing. But it's basically, it's this metric that assesses the nutritional quality of food by comparing the amount of essential nutrients it has to their calorie content. So it helps identify foods that are rich in nutrients but low in calories. And so beef liver has one of the highest, nutrient density indexes.
Yeah.
So, just for example, spinach has a nutrient density index of 740. Kale has about 1,000, whereas brown rice has 85. It's just, you're getting a lot of carbs and stuff like that, but you're not getting a ton of nutrients just eating rice.
Yeah.
And then soda has 0. You're doing nothing beneficial for yourself,
right?
By having that. But because beef liver is so nutrient dense, you don't need much of it.
If you're gonna just eat the actual liver part of it, we're over here gagging. but if you do, you only have to eat that 1 to 2 times a week because it has 700% of your vitamin A, 1,000% of your B12, 65% of your folate, 30% of your iron, that heme iron. And then it's got like zinc and copper and selenium and all of that. Or you can take it like as, in a capsule form, at lower dosages that you can just take daily.
Yeah.
And I love that it's also got this glutathione, which is like, that helps hormone detox. We talked a little bit about that, like in the liver and gut stuff, but NAD and glutathione are big deals right now. Everybody's trying to like amp those up and like do more of that because it can like be really helpful for like aging and energy and all that kind of stuff. So like, dang, you could just do some beef liver and kind of get like all your multivitamin, all your iron, all your glutathione.
Yeah, and it literally like just comes in a capsule and looks like this powdered stuff. But it has all of these good, like the vitamin A and the zinc and the iron, that are so important for your thyroid and your progesterone production, which are all super important for your hormone, hair growth
and your
situation.
Hair. That's right.
Yeah.
Okay, so let's talk about like what do you do? If you have hair loss, you're coming to see somebody to talk about hair loss. From our standpoint, it's like, let me listen to you first and foremost. What's going on in your life? What has been going on in your life? Where are you in perimenopause, menopause, postpartum, whatever? What medications are you on? What maybe new changes or stressors have happened in your life? All of these things like paint a good picture and help us determine, where maybe hair loss is coming from.
Yeah. Did you have COVID 17 times?
Yes.
Are you on Ozempic? All those things.
Right.
And then like initial labs that may be helpful to us are a CBC. We're always going to want to do specifically an iron panel and look at that ferritin, even if you have a normal CBC. Some thyroid panel, which is going to always include free levels, free T4, free T3, as well as a TSH, but it's not just a TSH. And then ovarian hormones, that's your estrogen, progesterone, testosterone. We can look at your cortisol. That one you really have to be fasting and it really needs to be in the morning. It's a little more difficult. So we use DHEA a lot. It's an adrenal hormone, but it's more steady state. You don't have to be, fasting or a certain time of day or anything. So it's a good like triage marker for adrenal health. And then you could get even deeper and do like zinc, selenium, and B12. You get more out in the weeds. The more and more out in the weeds you get, the less likely insurance, I think, would be to kind of, CBC, thyroid hormones, estrogen, progesterone. Yeah, that's, probably not going to be very difficult to get insurance coverage. Still, most labs are going to go towards deductible, but, so covered and have you met your deductible yet are two different things, but, zinc and selenium and B12 are usually not even going to fall into that preventative type of space.
Yeah. I think those are important. Like if you've done all the other things, like a full work of everything else, and it would be highly unlikely that all of those are optimal. Yeah. So let's say you get all of those optimized. Yeah. Well, in the meantime, that's probably going to be optimizing your zinc and selenium and B12 as well. But I think that those are nice to kind of keep in mind if it's like, dang, I've done all this, my hair is still an issue, then like, okay, let's see, like, let's look even further into some of these like more specific nutrients.
Yeah. Yeah. And then treatment things. Obviously, we're going to tell you that you need some hormones. If you're in a hormone deficient space, that makes a lot of sense. If you're perimenopausal, we've got estrogen swinging all over the place, or we have a relative progesterone deficiency. I don't know. This is round 2. I don't remember. But if we said that progesterone also can help with the hair, did we hit on that?
Talking about like it helps block that conversion. Yeah.
Yeah.
Testosterone to DHT.
Yeah. I don't think we really, I don't know. Now we've done this twice, so I don't remember what we said. But yeah, progesterone is super important in blocking that testosterone to DHT conversion. And so, yeah, that's always important, perimenopausal, just for sleep and anxiety and all that. But then if we could also help, you know, in that space too. And then, do we need some testosterone? And if we're going to get on testosterone, do we need to think about some spironolactone or maybe, progesterone to help with that conversion thing? But yeah, we're always going to, you know, obviously we're hormone providers. We're always going to be like, hormones are the answer. But estrogen and progesterone can help shift hair back into that growth phase. Spironolactone, if we need to add that to block the conversion to dihydrotestosterone. Ketoconazole shampoo is also helpful in that space. I mean, that's kind of a prescription shampoo that's, I guess to me sounds more annoying than just taking some hormone is to like wash your hair with it.
Well, and a lot of these you have to either do it daily, which I'm not washing my hair daily, or you have to which is all okay. Like obviously, if you've got some hair issues and we've got to address them and need to do these things, but some of these you have to apply them and then like leave them on, either overnight or whatever. Yeah.
Minoxidil is like Rogaine, and I think there's good data that it works, but like literally you have to use it every single day, foamy stuff in your hair, let it set. And like, who's going to really be compliant with that?
I know.
And so it has lately become a thing where people are doing oral minoxidil, which does have really good results too. But I think you have to be careful there because it like contributes to overall hair growth. And so like you may have hairier legs, you may have, and so it's like a trade-off. Like I don't want to have to shave my legs every day now just to help hair growth. Right. So, and then we get out into more of like almost the med spa dermatology space, but there's some evidence for platelet-rich plasma injections. That's where they draw your blood, isolate off the plasma, inject it back in. And that has been studied. My understanding is that is very painful to get done, those injections into the scalp. And then I think there's a lot of thought of like, why are we using my plasma? Like, aren't I the problem? I'm the one with the hair falling out. And so now you're going to put my own plasma back in. This is weird. And so now there's been a big push towards like growth factors and certain peptides, and exosomes and that type of stuff.
Like these outside sources to put onto the scalp.
Yeah. And that's more like med spa dermatology type stuff. Kelly Casperson, one of our favorites, did a podcast with this guy who's like a hair specialist from Chicago. And it was amazing. And he talked a lot about those type of things. Yeah. I think that's more, I wouldn't say your first line go-to is go get an exosome and inject it into your scalp. I mean, first line is going to be, let's get our ferritin and hormones corrected.
Yeah. I think you've got to start from like the bottom, work your way up. You've got to start from the inside out. It's not going to be helpful to like, use some certain type of shampoo or get really expensive shampoo if under the surface things are still not right. So I think get your foundation right first.
I know, and the online market push towards just perimenopause and menopause. We're an easy target because you tell me something's going to help with my hair, I'll pay $100 for it. Sure, no problem.
Yeah,
but like we need to understand what we're doing here, and so if you're paying $100 a month for a hair growth supplement, that really is just kind of a thyroid supplement that you could probably get for $20 a month. But because someone called it a hair growth supplement, they charge a lot of money for it. It's like, because you said it was for a wedding, that venue is a lot more. You know what I mean?
Right,
it's that whole phenomenon of like, I need flowers versus I need flowers on Valentine's Day.
Yes.
I think so we have to be careful not to get kind of snackered.
Sounds
snuggered in.
Snuggered in sounds like something my grandma would say.
Suckered in by all these like snake oil, salesmen. So,
and then of course, like we always say, and it always kind of just comes down to stress less, eat healthy, move your ass, and take your hormones. I mean, that's the bottom line.
Snuggered in.
Sleep good.
That's right. I mean, that's always going to be the advice. And again, most of that, I feel like if you get down to the bottom of it, is regulating your cortisol. So,
and I'm all about kind of keeping it simple because a lot of like extra things seems unsustainable to me. So
yeah,
I'm like, let's break it down. What do you need? This, and this, you know, and let's just kind of work from there. But yeah, can we make good food choices? Yes. Can we get some exercise in? Sure. Can we maybe sleep better and have less stress? I don't know. My children don't seem to be
probably not
helping in that area, but that's okay. I'll do what I can.
That's right. So to sum it up, I mean, hormone health is crucial for overall health. So we don't need to think of our hair as just like an accessory, and it's fine if everybody gets old and their hair gets dry and breaks, and that doesn't matter anymore. I mean, I think it's okay to almost have a little vanity there, and I think if we're really being honest, the hair is kind of a window in to maybe some internal things that are going on. So if you're having big shifts in your skin, your hair, and those kind of things, you're probably having big shifts other places in your body too. And your hair is just sort of that outward, very obvious manifestation of that. So we need to be taking care of our overall underlying health. We'll have better hair health as an outcome, but we'll also have like better longevity. We'll age better. We'll have that better like lifespan type of thing. And so that's really what it's all about. Hair is a nice little byproduct.
That's right. Yeah. That's right. Yeah. So next week, we're going to just keep on with this head to toe menopause series, and we're going to have a local ENT, Dr. Hernsberger, who's been in practice a long time.
Yeah, I think
we'll get all his bio info and all that stuff.
I guess like 25, 30 years.
Okay.
He has daughters. He has twin daughters that had babies recently because I took care of both of them when they had babies. And so he's got, he's a grandpa, and so he's old enough to, have daughters that are having babies. So I feel like, he's probably been in practice 25 years or so. So he's been around a while. He definitely knows what he's doing in the ear, nose, and throat space, but he is also savvy enough to know that the lack of hormones impacts people on that level too, with like, he says he sees voice changes, dry mouth, itchy ears. Like he sees women with all of these complaints all the time, and he's like, I just want to tell them that they need some estrogen, but I don't want to write the estrogen. I don't want to become a hormone provider, but I just want them to know how important that is. And
I love that.
I know. And so, we want him to come and kind of give his expertise on that. And then I want to ask him if you make more earwax because, I seem to be. Maybe I'm just nasty, but I mean, just little questions.
Just in your perimenopause phase, girl.
But I mean, we're just gonna ask him all these questions. So if y'all want us to ask anything like that, then email us. It's humpdayhormones@gmail.com, and we will ask him all of your ear, nose, and throat questions.
I'm excited to have him on.
Yeah. So if this episode resonated with you, share it with a friend, or if you know someone who's dealing with some hair hormone issues, share it with them. Follow us on Instagram and Facebook, also on YouTube now. You can see us maybe when we hook up the video right and we know what we're doing. Email us your questions for the show. You can find our clinic. We work at the Women's Clinic. We are arobgyn.com.
So, and just a quick reminder that everything we talk about here is for informational and supportive purposes only. It's not medical advice. No doctor-patient, provider-patient relationship is established on this format. Your body is unique, so be sure and chat with your healthcare provider before making any changes to your health routine. Listen to our podcast on Apple, Spotify, and I guess you could listen and watch on YouTube. Share it with a friend, leave us a review, and we will see you next Wednesday.
Yay! Happy Hump Day!